Well, happy Monday is how it's been billed. 3 days of sunshine added into the mix of people getting the more freedoms back than they've had, some of them for 3 months or more. But should we be celebrating today? Steve Baker is Deputy Chair of the Conservative Group of MPs, the Coronavirus Recovery Group. Steve, I want to be happy today, and I'm delighted I can go to a friend's garden tonight. But I have to say, I find it quite bizarre that people in Britain in the 21st century are celebrating being allowed to meet up with their friends and family in limited numbers in their own back gardens. What happened to this country?
Julia, good morning. And I, like you, do feel that it is bizarre. I feel like I woke up one day and found myself in a brave new world of long-standing nightmares. But yes, it is a happy day that we've got this small amount of freedom back. We are being allowed to enjoy outdoor sport and meet friends in two households of the rule of six. But these are small mercies. It almost feels like Stockholm Syndrome, that bizarrely we're to be grateful and happy to have such small joys. But nevertheless, it is progress.
It does feel to me like the only people who don't have Stockholm Syndrome are the people who live in Stockholm in Sweden. But there we are. We're at the front page of the Times today. Embrace your new freedoms, but don't hug. That's going to be the advice from Boris Johnson at a press conference today. If he thinks seriously anyone sitting in watching telly other than people who are obliged to do so, like me at 5 p.m, he's got another thing coming. We're being told that we need to remember not to hug when we see our loved ones. People being allowed to travel even across the country to see their loved ones. I just want to clarify: is not hugging guidance, or is it actually a crime right now for me to hug a member of my family?
Well, I am 99.99% sure that it is not a crime to hug someone, but I would actually have to tell you, in the absurd world we live in today, I'd have to go and double check. But I did listen carefully to some
isn't it?
It is extraordinary, yes. I can't help but smile. So I did listen to Sir Mark Walport on the Today programme earlier, and he was urging people to be cautious, but he wasn't actually saying you couldn't.
Oh, well,
but you know, where I would like us to be is for people to be taking personal responsibility for their risks. If people are outside and they're adults and they've been vaccinated, then they should be free to take the choice, is my view. But equally, you can see why the public health establishment, concerned as it is about cases rising in France, in Germany and Italy, are asking people to be cautious. So I can see why they're doing it in their own
But this
terms.
is the thing that lots of people are confused about. We're not allowed to travel abroad. The only people who've been allowed to come in and out of the country are business people. Apparently, it's perfectly okay for Prince Charles and Camilla to travel to Greece to attend an event. And apparently, that's absolutely fine. But the only people who've been going in and out pretty much have been the hauliers, and we haven't bothered testing them, bizarrely, even though they're tested going into France. But right now, today, we are in the same position in terms of deaths and hospitalisations and infections from coronavirus as we had in the last week of June last year. And yet a week later, last year, we lifted pretty much all the restrictions. People were sitting in the pub on the 4th of July. That was when not only we did not have 30 million people vaccinated, we didn't even know if we would ever have a vaccine at all for coronavirus. Why are we able to have been out of lockdown a week later from this point last year, and today we're going to wait another 2 months for the same rights?
These are great questions, Julia, and that's why 63 Conservative MPs wrote to the Prime Minister and said we'd like hospitality open at Easter because, of course, hospitality invested in becoming COVID secure. We've heard from public health experts that hospitality wasn't a major source of transmission, and so that's why so many of us wrote to the Prime Minister and said, please, come on, let's get hospitality open, because we believe that vaccines will be effective, and so it has proven. So that's what we would have liked to have seen. But I think now I have to accept we've lost the argument for opening hospitality this Easter. But you raise a very good point. I suppose I can't answer for ministers. I'm a backbencher, but I would say that the truth is people are all just terribly, terribly frightened at the moment. Whether that fear is proportional and reasonable is another question. Only this morning I was looking at some news from Texas, which abandoned all restrictions 2 weeks ago amid terrible warnings that it would lead to enormous surges in cases and deaths. And so far it has not. So it'll be interesting to see how that develops. But yeah, these are great questions, Julia, and I'm with you in asking them.
I wish more journalists were asking them of the government ministers. Unfortunately, a government minister wasn't available for our show. Amazing. The health department's always very, very busy these days. But this is it. It's not just Texas, is it? It's Florida. It's the Dakotas, particularly South Dakota. It's Sweden. When you look at all these different either US states or countries around the world which have done something different, the evidence is very clear, and huge numbers of medical studies and scientific studies by highly eminent, Stanford professors and the like have shown that there isn't any link, any correlation, and certainly no proof of causation when it comes to a cut in the number of deaths as a result of lockdowns happen at all, how soon they happen, how long they happen, how strict they are. We just haven't seen this correlation, and yet we go in and out. But it seems to me a lot of this policy is led not just by the sage advisors, whose job it is just to worry about COVID and nothing else. And we know the huge costs of lockdown, talk about it on the show every single day. But also the fact that it's led by public opinion. And we've got the strange situation where SAGE, we know from back in February, March last year, they had a conscious decision to try and terrify the country into their homes by terrifying them about the risk of coronavirus. The government pays millions of pounds of taxpayers' money to have adverts on non-stop. They're on this channel as well. Every bus stop, every TV station, every newspaper, every radio station, telling them that basically if you step outside your home, you're going to die or you're going to kill someone's granny. And now we've got a terrified population who won't come out of lockdown and who are telling the government they want the lockdown to continue. And so the government is, because the public don't want it, are continuing the lockdown. And we've created this vicious circle. When do we ever get out of it?
Well, it does seem like a doom loop, and it is for the Prime Minister to break that doom loop. I agree that there is this problem, and the Guido Fawkes website reported some polling last week, which I referred to in the House of Commons. It seems that perhaps 8 million people have got additional mental health problems because of the government's advertising. I know my friends in government wish to assist people with mental health problems, reduce overall suffering from mental health. And at the moment, it looks like the best thing they could do, the fastest thing they could do to improve mental health in the UK is to stop these adverts, which is quite a position to have reached. But on your point about correlation between lockdowns and deaths, I've got to be very careful what claims I make. I have read many papers on this subject. Just this morning, I was looking at the data of comparing Sweden to the UK on deaths, and also comparing those various US states. And I have to say, it is beyond my ability to spot any correlation between lockdowns and deaths. It looks like the virus is studiously indifferent to lockdown measures. But equally, I have to recognise that a software engineer glancing casually at some correlations on the screen is not a scientific study. So if I were a minister, I'd be commissioning some really serious research now to check whether the most restrictive so-called non-pharmaceutical interventions actually did more good than harm. And that's why I've been calling for a new Public Health Act, because never again should we be in a position where ministers can impose these kinds of measures at the stroke of a pen with retrospective approval from Parliament without actually proving, as far as you can, that they do more good than harm.
It is fascinating when people argue on this point, whether it's politicians or many of the leading academics who criticise this, and you'll know as well as I do how many academics and scientists and medical professionals at a very high level absolutely deplore the lockdown policy, but if they speak out publicly, they're worried their careers will be damaged and the abuse they'll get, as we've seen what happened to the Great Barrington Declaration medics and scientists. There are a lot more people who are opposed to this in the profession than say, but also journalists like me, that we're constantly told, well, show us the proof that lockdowns don't work. It's like, well, I mean, I can show you the proof, but you keep ignoring it, I always answer. But anyway, it is not for us to show the proof that lockdowns don't work. Surely, if you're introducing a policy that steals away the freedoms of 67 million people, the onus should be on those taking the freedoms away.
Absolutely right. Yes. I mean, the rights of a free people include being able to go and see their parents or travel overseas, for example. And yes, absolutely, the burden is on public health professionals to demonstrate that what they're proposing does more good than harm. But let's be realistic here.
And even if it did do more good than harm, they still don't have the right to impose it on people who choose not to have it imposed on them. Either we're free or we're not.
That is a very, very important debate. And libertarian leaning as I am, even I recognise that things like the European Convention on Human Rights does have escape clauses, as it were, for public health. Because I think we have to recognise that with serious infectious diseases, sometimes you have to give up some freedom. And I wish to be reasonable about that, much as it's difficult to admit. But I think that at the moment, there are some very, very serious questions to be asked about whether these enormous restrictions on our freedom really are worth the candle, and the undoubted harm that they they've certainly done to people right across the country.
Well, I mean, leaving aside the £1 billion extra a day on the debt, which will have to be paid eventually, and the hit on people's, jobs and businesses and mental health and physical health, as we know, as if people are comfort eating and comfort drinking. The stats are very, very clear on that. And not getting cancer treatment, mental health treatment. We're going to be living with this for decades and decades. And I like to say, I think the backbench MPs like you, who aren't just nodding dogs to the government, are actually doing the government a favour by pointing out the risks they are taking. Because in a few years' time, when whether it's a few months or a few years, the British public wakes up to the damage that's been done by lockdown without any actual saving of lives, I think they might feel rather differently about this and rather resent the lies they were told. Just finally, I want to ask you about vaccine passports. Michael Gove, the man leading on this issue, leading a review, but talking to the Israeli government about how their vaccine passports work, their green card system, talking to Tony Blair, who's been calling for vaccine passports, I think even before we had the virus. It doesn't seem to me that review is going to go anywhere other than we end up with having to prove our medical status in terms of vaccines to go and get services in this country. Is that going to happen?
It's an absolutely horrific prospect. It does feel like something of a fait accompli at the moment, but I have to say it seems to have been met with an enormous raspberry so far by the hospitality industry. So I hope that raspberry continues. And actually, I hope the public say no, because actually it's going to be unnecessary. Once we've been vaccinated, once people are protected, it's not going to be necessary to prove our vaccination or indeed testing status in order to go and mix with other people. We know the vaccines work. So, I mean, this is a really sinister, I'm afraid, development. It feels sometimes like the same cast of characters who wanted ID cards now want us to prove our health status. Yeah. I mean, this should be a very, very private matter. And the idea, it's lovely to say property owners should have strong rights over who to admit, but actually we don't normally allow that because we know we'd get unacceptable discrimination. So we say you must open your doors to all equally. Well, it'd be an extraordinary thing if we now said people have got to acknowledge their health status to get into a pub.